Hi everyone, this is Health Checks with Dr. Memstic. Today we'll be talking on the concluding part of breast cancer. Breast cancer, we'll be talking about the signs and the symptoms of breast cancer, how you can prevent it, and the screening that helps with early detection and possibly the treatment modalities available. What are the signs and symptoms of breast cancer? The commonest sign and symptom of breast cancer is a lump. It's important to say that not all lumps are cancerous. Studies have shown that 80% of lumps in the breast are non-cancerous. So, but then if you notice a lump in your breast, please, you need to seek professional help. It's not a symptom you should ignore or look over, because on your own, you're not going to be able to tell if that lump is a cancerous lump or a non-cancerous lump. So you have this lump on in your breast, and the lump is hard, is attached to the structure, the underlying structure of the breast, and it's irregular in shape. It's a pointer that may be a breast cancer lump. The other kind of lump maybe is soft, smooth surface, and mobile. And the other causes of breast lump could be hormonal changes. It could also be an abscess or a cyst. Okay, so those are the other causes of breast lump. But then a lump is not a symptom you should ignore. You should look out. Go to the health facility once you notice a lump and have a doctor or a nurse examine your breast. The next symptom of breast cancer is change in your breast. It means that you know your breast. You know what the normal breast looks like, and that is why you're able to quickly detect an abnormality in your breast. That is where you have to learn how to examine your breast, and we'll be teaching you this in this episode. The next symptom you should look out for, the changes in the skin of the breast, dimpling. You know how the back of an orange is? That's dimpling. If your breast is like that, we call it peeled orange. If you notice that, please seek professional help immediately. It's not a symptom to ignore. Another symptom of breast cancer, most of the lumps are not painful, but in some cases you may have a breast pain. Sometimes even a lump in your armpit is something you shouldn't ignore that. You notice a lump in your armpits, even in your clavicle, your collarbone up here, it is not something you should ignore. Another symptom of breast cancer would be discharge, nipple discharge. You're not a breastfeeding mother, and then you are discharging, not milk now, maybe blood or a clear fluid. It is not a symptom you should ignore. These are the pointers that there's something wrong with your breast and you should get to the hospital, have a medical doctor, have a professional examine your breast. How do we diagnose and encourage early detection? As with every other cancer, early detection saves lives. For breast cancer, as a woman, when was the last time you examined your breast? Have you ever carried out a self-breast examination? Do you know how to do it? It is very important. When we talk about self-love, self-care, part of the self-love and self-care is your self-breast examination. They are your breasts. You should own it. You should be able to examine it. And when is the best time to examine your breast? Immediately after your menses. You should carry out a self-breast examination at least once in a month. By so doing, you will know what your normal breast feels and looks like, and that will help you to pick an abnormality, because you know the normal, it's going to be easy to pick the abnormality. So, a self-breast examination, quickly you stand by the mirror, you're not wearing anything, you're not wearing bra, you just stand by the mirror with your hands by your side. You look at your breasts. Look at it. What are you looking out for? The size and the shape of your breast. Normally, one breast is slightly bigger than the other. But if you notice a significant increase in size of one breast over the other, please, that is a pointer that there's something wrong with your breast. So you look at your breast, look at the skin over your breast. How do they look? Is there any obvious swelling? Is the skin over my breast like dimpling or like the back of an orange? Or is there a rash that has been persistent? Or is there a wound that has refused to heal? This is a pointer. And then you look at your nipple too. Previously, you're a woman who your nipple used to be pointed out, and now in recent times your nipple is going inside, is retracting. That is a sign of breast cancer. That is not something you should ignore. After looking with your hands by your side, you lift up your hands above your head and you look into the mirror. You're still looking at your breast. You want to see if you're going to observe an obvious swelling. And when you're done, you put your hands on your waist. Press on your waist and still look at your breast through the mirror. If there's a swelling, there may be a bulging by so doing. And then now, what next do? You want to examine your right breast. What do? You're going to be using your left hands to examine your right breast. When I say hands, you're using the palm, this flat part of your forefingers. So what you do is you lift one hand above your head, and then with the flat surface of these forefingers, you use an imaginary line. Imagine that your breast is divided into 4 quadrants, 4 spaces. So you start with the flat surface of your left hand and the right lifted. You press on your breast. You're not pinching like this. You're pressing flatly in a circular manner, circular manner, circular manner, circular manner. And then you press on the nipple. And then when you're done, you put your hands also in your armpits and press and massage for any lump. And then your upper part of your bone, this collarbone, you also massage if you'd find any lump there. And then you press your nipple with 2 fingers to look for a discharge. You do the same thing for the other breast. Now you'll be examining the left breast. You use your right hands with the left hands lifted up, and you go round the flat surface. You're not to pinch. You're not to pinch. You go round in a circular manner over the 4 quadrants. Don't forget your armpits. Don't forget your collarbone. And then you press your nipple for a discharge. Any discharge that's watery or bloody may be pointing to a breast disease, and you need to get it checked. It may not necessarily be a cancer, but you need to get it checked. Don't ignore that breast nipple discharge. That's how to carry out a self-breast examination. And periodically, you should get to the hospital and have a doctor carry out a clinical breast examination for you. Thank goodness our Medical Women Association of Nigeria Secretariat also carries out breast cancer screening, not just cervical cancer. So you could walk in there on a 3rd Tuesday of the month and have your breast examined by a medical doctor, so that if there's anything there, they can pick it up and further investigations and diagnosis will be made. That is the only way you can save life, early detection. And for women who are over 40 years, it is expected that you have mammogram done, mammography. Mammogram is a kind of x-ray that helps to even detect cancer cells even before lumps are formed. So every woman over 40 years, we should plan to have at least have a mammogram done to check our breast. That's what the ways in which we could diagnose breast cancer easily. For the prevention, I had already talked about the risk factors. For the ones you can change, the lifestyle modifications, your diet, we have to change what we eat. We cannot be eating junks. A highly processed diet with saturated fat is a risk factor. So what should you be eating? Every meal of yours should have vegetables, should have fruit. You should go for whole grains as your diet. And then get physically active. Get active, whether walk, cycling, exercise. That helps you to maintain a healthy weight, because obesity is a risk factor. So we must be physically active and we must eat a healthy diet. If you smoke cigarettes is implicated in all forms of cancers. Please quit smoking as a woman. And if you drink alcohol, do it in moderation. Reduce it. Excessive alcohol has been implicated in breast cancer. So that is it for the preventive measures. And women who have babies, let your babies suckle. Let them breastfeed. Suckle your babies. WHO recommends that you allow your babies to suckle on the breast for at least 2 years. It's a protective measure for we women. And if you have a family history of breast cancer, please, you need to be more proactive. We talk about self-love. Self-love is being proactive, taking charge of your health. Your health is your responsibility. And this could save a life. What are the treatment options? Treatment options for breast cancer depends on the stage of the breast cancer. That is why we encourage that this cancer should be diagnosed as in, early detection is key. When it's picked earlier, treatment is more successful when it is picked at an early stage. So you have the option of surgery. It may not be total removal of the breast. Sometimes they can have a conservative breast surgery. And then you have the option of chemotherapy, where drugs are used to kill the cancer cells, or radiation, where we use radiation therapy to kill the cancer cells. So this can be successfully managed if it is detected early. That is why I encourage women, take charge of your health. Your breast is yours. Don't be that woman that has never touched or massaged her breast. Massage your breast once every month, because so doing you will know what your normal breast feels and looks like. And when there's an abnormality, you're going to be able to seek for help. And please seek for help from the right sources. It is not a disease that you should carry to the church and go and stay in the church or go to the chemist. Go to a hospital, have a doctor examine you. Thank you very much. We are open to questions. Like this video, please. Share it. You may be saving a life. Share this video. Subscribe to our channel. Information is power. Ignorance is not bliss. Like, share, tell a friend to tell a friend. Let's all be our sisters keepers. Thank you very much.